Okay, let's talk about calcium acetate. One of the trade names for this medication is PhosLo. Okay, and we're going to talk about why that's a trade name for this medication and what that really means. So the generic name, calcium acetate. Treatment, the reason this medication is given is for treatment of hypocalcemia, prevention of post-menopausal osteoporosis, treatment of hyperkalemia and hypermagnesaemia, and also to control hyperphosphatemia with end-stage renal disease for patients who are on dialysis. Okay, so let's talk about some of the way that this kind of works. So with end-stage renal disease for patients on dialysis, the way that calcium acetate works to control hyperphosphatemia, so that's high phosphate levels, is that it binds to phosphate in food that we eat, and it prevents the absorption into the gut. Okay, so it prevents phosphate from getting any higher by binding to any phosphate in the food and thereby preventing it from becoming absorbed. And that's kind of the same way that it works in hyperkalemia and hypermagnesaemia, is that it binds to the potassium or binds to the magnesium, preventing it from getting any higher. Okay. Now, with that in mind, it's also important to understand that if we're giving this for a patient who has like hypocalcemia, so they have low calcium levels, so we're giving them this calcium, one of the things that it can cause is we need to really monitor other electrolytes, okay? Because if we're giving it for the low calcium, we need to understand that this patient could develop hypokalemia, hypomagnesemia, or hypophosphatemia, okay? So because it binds to these other electrolytes and things, we need to understand that it can cause a reduction in those levels while raising the calcium level, okay? So calcium is essential for nervous, muscular, and skeletal systems. It helps maintain cell membranes and aids in transmission of nerve impulses and muscle contraction. So it helps with our heart muscle, helps with other muscles, and it aids in blood formation and coagulation. So it plays a huge role within the body. And so it's important to monitor our calcium levels and make sure that they're within range, and then to monitor other electrolytes and understand that we can give this to help lower some of our other electrolytes. But because of that, if we're giving it for calcium, it can lower those electrolytes too. Does that kind of make sense? Hope that makes sense. Okay. It's going to bind to these other electrolytes, preventing their absorption. Okay. And so it can raise our calcium levels, but it can also lower these other ones. Okay. So one big one to keep in mind here is really, like we said previously, is that it can be given for hyperphosphatemia with your end-stage renal patients who are on dialysis. All right. So its therapeutic class is mineral and electrolyte replacement / supplement. Pharmacologic class is antacid. Some nursing considerations to keep in mind. We've already talked about some of these, but it can cause cardiac arrest and arrhythmias. We need to monitor our hemodynamics. Remember, we're going to kind of mess with our potassium and our magnesium and things here, and those are critical electrolytes for our cardiac electrolyte rhythms, okay? So as we kind of mess with potassium and magnesium, we can really lead to arrhythmias. We need to, it can also cause hypotension, bradycardia, and we said arrhythmias. Hypercalcemia can cause increased risk for digoxin toxicity. So if we're giving our calcium, we really want to monitor our calcium levels. If our patient's receiving digoxin, also we want to monitor their digoxin levels and monitor for digoxin toxicity. One of the big things we're going to see there are these visual disturbances, right? Administer slowly because it can cause phlebitis at the site of insertion, and instruct patient on foods that contain vitamin D and encourage adequate intake. To help with calcium absorption, we need vitamin D, right? Vitamin D is kind of our adjunct that we give there to help with the calcium absorption. All right, so that's kind of a little bit more complex maybe because we're digging in there to electrolytes, but I hope that makes sense, and that is calcium acetate. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.